some months back, the medical professionals, there was this crisis between the medical professionals and the government over conditions of service. That is gone now. They've gone back to work. But the after effects on our lives as a people, on our economy, we may not fully recover from it in a long time. Because this set of people contributes immensely to the economy of Nigeria, to the well-being of our people. And then because of something I feel is inconsequential, because when people talk, we can always settle issues, and then these issues went on and on and on and on and on and on. So what to look at today on our discussion segments, facts, face, and forum, the aftermath of this brain drain on our economy. My name is Peace Isaac Hirokun, and I welcome you to today's edition of Facts, Face, and Forum. After the break, I'll introduce my guests. Alright, you're still on to Facts, Face, and Forum. My guest today is the Publicity Secretary, Nigerian Medical Association, Dr. Badmus Adeola. He is my guest today. You're welcome.
Thank you.
Thank you for your patience. It's been a very hectic day. Thank you for your patience, and thank you for being here.
You're welcome, and thanks for having me here.
We experience major brain drain. I mean, in my lifetime, I don't think I know people, Nigerian doctors, medical doctors migrate, but I never saw it that bad. When this, when people were on strike, and then trying to resolve the crisis. I don't want to ask you what were the major issues, because we had so much about it. But then, I did ask you off camera that I know that one of the codes for Nigeria, for medicine or medical doctors, is to save lives. And here, you were on strike for a very long time. We are expected to be patriotic citizens of our country. Here, you went on strike for a pretty long time. Were you thinking about patriotism at the time that you embarked on that long strike?
Yeah, thank you. Well, it's a sad situation, but before I will go ahead, I think I would like to express our sincere condolences to the families and friends of the people that died during this building collapse. Well, it's part of the systemic failure, because that shouldn't have happened, because we have regulatory agencies that are supposed to be in charge of that, but unfortunately that is happening. So going to what you said, well, I don't think there's any doctor, being a young doctor or old doctor, that is happy with the health system of Nigeria. And there's nobody that is happy going on strike, because as you have said, we've sworn the oath of the Hippocratic oath of saving lives. But if you know, we are all Nigerians. Before you can save life, you have to save your own lives too. So if you have people going several months not being paid, they also have their needs. They have their family, they have their own things to sort out. So if all that is happening, I've gone to every length to see if that can be resolved amicably, but nothing is happening until you have to go to the last result, which is the strike. Even though this strike you are talking about, despite that, it has been called off. More than 50 or 60% of those agreements had not been fulfilled up to now. So that's the situation where we find ourselves, and we pray that things will get better as time goes by.
You've had all the period to negotiate.
What?
Why are we still talking about negotiation at this point in time?
What happened is that after the Nigerian Medical Association, which is brain bodies, tried to mediate, that was what led to the calling of the strike by the Nigerian Association of Resident Doctors. but hoping that with the promise by the federal government that most of those things or virtually everything will be resolved. But up till now, we've not been able to have up to 50% of those agreements implemented.
But at least they've started implementing some of the promises.
They've started implementing some, but the inertia is getting too long. But
Were
hopefully,
you given a time frame? Like
because at times when you want to try to resolve an issue, at least you set the process in motion. Like the issue of the medical residency training fund, we heard that there was some misunderstanding in payment, that they had to retrieve back the ones that have been paid before. But hopefully, maybe after like a few weeks to now, they'll be able to start the payment. You heard that they'll start making the payment. But until it is fully paid before it can be rest assured. Because we've had so many promises from the government.
Well, I don't want to, because I'm not an authority, to sit here and say Nigeria is broke. But we had feelers that it's not all going well with the Nigerian government, and I'm wondering how they are meeting up with these payments and all of that. Did you people just, had a little bit of consideration as to what is happening there economically and why they are not meeting up to the expectation?
What, sincerely speaking, if not for the consideration and patriotism that we've had for a very long time, we won't be here. Because for us to even be sitting down negotiating with the government, because of the consideration that we have for all the economic status of the country. But before we can ask for anything, we've usually made our homework. We'll have done our homework to see that those funds are actually available. Because they are not that they are new things, they are things that have actually been approved and the funds are available. It's just that the government is not seen it as a priority to tackle it. That's the problem. It's more like misplaced priority.
Now, what the consequences both ways, as a group you are not paid, and then the other way in the part of what's happening in the economy. What do you think has happened now with all of your counterparts or your colleagues migrating to other countries?
It's a very sad situation, because if you take your time and go to virtually all the hospitals in Nigeria, you see thousands of doctors and nurses leaving virtually every day. You can just try to talk to one or two of the MDs of different hospitals in Nigeria. They will tell you that there's hardly a month that they don't get resignation letter from doctors and nurses. Though other health workers are also affected, but it's more with the doctors and nurses. There is a study that was done, I think in 2019. It showed that from arts officers to professors, there's about 80 to 90% of doctors that one stage of processing their traveling out or the other.
There's this saying that the grass is not always green on the other side. You people, because I know that we all know that profession is like hot cake outside, over there. But taxis and accommodation and people have gone over there, say to us that it's not that simple, it's not that easy, the life. So what's your opinion?
Yeah, that's true. But what you should know that there's what you call relativity. What you put in here in Nigeria and with the little you are getting, if you put in almost the same thing over there, you see maximum effect. You have thousands of friends over there and they are doing well. Of course, it's true that not that everything is just green over there, but you have to work. Once you work, you put in your best, you work, you follow your ethics of practice, you have a kind of relatively fulfilling life, far more better than what you're having here.
But there's no place like home. So
that is fantastic. That's the truth. There's no place like home. And that's why a lot of people, even though our colleagues that are over there, they're also praying and praying to the government to make things work here. Some of them are willing to come back, but they can't. They can't. What are they coming back to do? Even the despite that they are working in the health sector, they don't have easy access to the health itself. So there are so many things that are wrong. Once government is able to put those things in place, and you have a better welfare package for doctor, better working conditions, some will definitely come back.
From your pay and all that, what exactly do you people want? What do you think can be done for you, and then you stay?
Well, there are so many things. The problem of brain drain is multifactorial. Apart from the pay is important, but it's not the most prominent. There should be better welfare package for the doctors and other health workers. And also infrastructure. You can take a walk around the hospitals and see the state of decay of the hospitals. You have infrastructural decay. Then also you don't have equipment, enough equipment to work with. Imagine you are managing a patient with cancer. How many radiotherapy machines do you have in Nigeria? You have thousands of patients that you are managing that are supposed to go for radiotherapy, but those things are not available. I am a urologist. We have a patient with prostate cancer that you need to stage the stage of the cancer to know whether the patient can benefit from curative treatment or palliative treatment. Because if you stage it and you're able to find out that the patient has organ confinement, you can actually offer the patient cure. But it has to go for some investigation such as radionuclear bone scan. It's not available. You understand? We have.
It's not available in any hospital.
It's available. I know it's available in Abuja, but that one is one. It will be available today. It will not be available tomorrow. Usage. They also have the machine. They also have problem with reagent. Then I think recently there is a private hospital in Nigeria, a newly set up private hospital that's also offering. So we have very limited facilities that are offering those services, and that is also what you have in other department of medicine.
And
apart from
that particular thing you mentioned, is it supposed to be available in every hospital?
No,
or designated
no. Designated center. At least every regional hospital should have it, so that I don't have to travel. Some patients go as far as going to Ghana, Kolebu Teaching Hospital, to have that done. These are things that the government need to work on. Radiotherapy machine, treatment of cancer they need to take drastic action to make that work. Because a lot of patients, you are in a consulting room, patients are coming to you, patient is dying, you know what to do, but don't have what to do, what to use. So it's discouraging. You go to conferences, you learn so many things, but you cannot come back to your country to implement it. So it's kind of demoralizing and discouraging. That's why people prefer to go to other centers or other countries where those are available, and you can make use of it. It makes your work better, easier, and also you also get fulfilled that you are saving lives.
There's a question bothering my mind, and that is, if the government starts providing facilities for you to work with and say, please, just for now, just don't even think about your personal well-being, like in your money and all of that, and say, okay, let's equip all the hospitals, let's do, are you going to stay? Will you still be traveling?
I also need to tell you something, that even though the ones that are presently in Nigeria now is because of our patriotism and the passion we have for this country. Because even though when you go to the hospital and you see the working condition, you be in some consulting room, you are seeing patients, you are sweating. The AC is not working, you have to open the window. This thing happened to me, I think, last week. I was in clinic, everyone was, well, we were still sitting down, still seeing the patient. So if you consider all those things, but I don't think any doctor really needs to stay in Nigeria for now. But because of the passion we have for this country, that's why we are still there.
You're making plans to go, because...
Not yet.
But every opportunity, you may just grab.
But funny, there are opportunities always coming virtually every day. Social media, as I yesterday, they were still circulating some information about people, some countries that are interested in some doctors, like having in need of, I think, 20 anesthetists, 20 this, 20 that. All you need to do is just call those numbers.
No, but
within a few months, you're out of the country.
In those countries, they don't have human beings.
They have. They have.
They're sourcing for
because they know that for you to have a good health sector, a good healthcare delivery, there is a minimum number of doctors to patient ratio. You need to go to most of our hospitals. You see, for you to see a doctor in most of the government hospitals, you have to spend the whole day because we have very few doctors available to see thousands of patients. So once you are going to the hospital, you just have to take away that day from your routine. But if you have enough doctors, it's not proper for patients to go to the hospital and spend the whole day in the hospital. That's also loss of manpower, and that's also affecting the economy. But if you have, because for the fact that you have shortage of doctors, that doesn't mean that you don't have enough doctors in this country for now that can be employed.
We hope that this nation of ours will be salvaged.
Amen.
Sometime soon.
Amen.
And we'll have all the doctors that we want here, and have the health facilities, and every single one of us, including my mom in the village and all those old people and the poor people, can access health care easily. Thank you again for being here. Well, I say thank you for being part of us today, being part of today's episode on Facts, Face and Forum. Sitting out there, watching me and watching us talk, you know, all of those kind of things, all of those grammars, and making you either feel sad or feeling happy and giving you hope or making the situation hopeless. Well, that's what we're supposed to do. That's where I earn my money. So my duty is to inform, educate, and entertain you. I hope I have been able to do that. And I hope someday we'll have the Nigeria of our dreams. We will not be talking about economic brain drain. We'll see you again next week. I'm looking forward to that. Bye for now.